First, you will need to gather all of the equipment that you need. You'll need clippers, a fluid line, bag of fluids, skin disinfectant, a catheter, some bandaging material, a syringe with some heparinized saline, and some tape. You may also have a fluid pump or just a drip stand. The bag of fluids should be gently warmed in a sink full of warm water. First, open your bag of fluids. There's usually a notch in the outer packaging to help you get this started. Next, remove the giving set from its packaging. Always be very careful while handling the giving set that you don't touch the insertion spike or the area where it will be connected to the patient catheter. It is generally easiest if you hang the bag of fluids up on a drip stand and then twist off the cap. Unravel your giving set, then use the roll clamp to turn the fluid line off. Remove the cap from the insertion spike and very carefully, without touching it, use the spike to puncture into the bag. You will see a ridge on the insertion spike which shows you the depth that the spike should be inserted. Squeeze the drip chamber to cause fluid to enter the chamber. It should be around about 1/3 to 1/2 full. There is a line on the chamber which is your minimum fill line. You may need to tap the chamber to remove bubbles. Leave the cap on the patient end of the line, then open the roll clamp and allow the fluids to run through the fluid line. In paediatric sets, you may need to remove the cap on the patient end to allow the fluids to run. If this is the case, be very careful not to touch the end of the fluid line onto anything and break sterility. Once drops appear at the end, turn the fluid line off to stop the flow. Check any injection ports for bubbles. It is very common for a bubble to be formed at the Y junction. Flick the line so that the bubbles shift to an area where they can be run through. If you have found a bubble, you will then need to open the roll clamp again and run the fluids until the bubbles have disappeared. Then continue checking along the rest of the length of the fluid line to ensure you have no further bubbles. Then hang the end of the fluid line up somewhere where it will be safe from contamination. There are many different types of drip pumps, so if you are using one, you'll have to ensure that you have the correct type of drip set for the pump. Line the giving set up through the correct notches in the fluid pump and then close the door. A drop sensor is then connected to the drip chamber. Make sure that all of the clamps on the line are open. Then set your volume to be infused and the rate at which it is to be infused. Press run and then spend a few minutes ensuring that there are no problems. If there is a blockage or any other problem, the machine generally has an alarm.